Next question I have is, and again, these are the three big questions I have are very high level. Speaking about the doctor-patient relationship, for you specifically, how has the transition from the old model to the current model changed the way you personally are experiencing, thinking about the doctor-patient relationship?
I think that's where the surprise for me in this transition was how seamless the transition was for me personally.
Mm-hmm.
And I think that's because I'm a very relational person. I love getting to know people, getting to know their families, their work, their priorities, so that I can, as their healthcare provider, be useful to them, be able to give them advice that really speaks to them. Mm-hmm. And when it comes to this model of care, the beauty is there's not the structured limit of time, of appointments, routine, so to speak, where I've recognized out of a traditional setting where you may have 15, 20, if you're blessed, 30 minutes with a provider, that you can obviously establish relationship and you can go to a certain depth, but it's still shallow.
Mm-hmm.
And there's beauty in that
Sure.
because we need healthcare for the masses. But as a relational person and as somebody who really likes to take it deeper, this has been beautiful for me, where that doctor-patient relationship is now almost what I'd consider truly medical friendship.
Yeah.
You're
Ooh.
really developing a friendship. I just happen to be a doctor. They may or may not be a doctor. And we developed this friendship where I've been able to have lunch with members and we chat about family. But then always in my mind is, of course, what's best for them in terms of their health, their goals, their priorities, and be able to kind of chime in and be that wise friend, so to speak, that has knowledge in the medicine world, in the health world. But I know my patients. I know their goals. I know their family.
Yeah.
I know the dynamics there. So I'm able to really hopefully speak into their lives in a much more deep and meaningful fashion than I ever would have in a setting that's more limited.
Yeah, you just weren't, you didn't have that capacity.
Mm-hmm.
You've coined some phrases that I'm obsessed with. You said, I became very good at the 10-minute sick visit and the 30-minute annual physical, that you optimized, given the constraints, to do a really, really good job. And it always struck me that was something that you had recognized and were able to put language around, because it really does encapsulate, especially for a depth-driven human like you, who craves deeper, more authentic relationship and understands that you just can't do that without time, because it takes time to build the trust. But you did the best you could, as many of our colleagues do. But I would even argue that you were on the blessed side of the spectrum, where many of our colleagues have 5 to 6 minutes for the sick visit,
true.
and they get 15 to 20 for an annual physical. And like, at some point, going that fast, you have to start trimming what you are able to address. And there's usually very little opportunity for depth, bond building, relationship anchoring conversation about how's the marriage, how's sleep, like what's on the horizon professionally over the next year, what are you worried about, what are your greatest joys over the next year, do you have like human stuff. It's checking boxes of cholesterol and blood pressure and diabetes screenings, and maybe you get to check their meds and see if they're current, or see that they were in the hospital and had their appendix removed 6 months ago. I mean, there's so much. You just do what you can, and you feel good about it in one sense because you're doing the best you can. But it's like coming into this model, being able to do that, but no longer having to look at the clock. You're not beholden to a timeline, unless, of course, your member has a hard stop.
Mm-hmm. True. Yeah.
It really, really is a wonderful, wonderful thing. What about some of the time you now find with your patients on, let's call it non-obvious doctor stuff, like you get to check the cholesterol, check the blood pressure, check the diabetes. Has there been any like experience on your end being able to have these conversations in other areas that are clearly part of this human's experience, but now you can incorporate into your thinking and your medical decision-making, your shared decision-making about lifestyle behaviors, those kind of things?
Oh, absolutely. And for years, I think I was probably maybe 3 years into my medical practice outside of residency. I was truly with one patient. I could go back to the room and explain the scenario, but for some reason, it seemed that I was able to consolidate so many of my goals and thoughts for this individual, but also others in my practice, where I focus on 5 areas of health. I consider there to be 5 foundations. They're nutrition, exercise, sleep, stress management, and then spiritual and relational health. Mm-hmm. And that just came to me. It was very almost a spiritual experience when I was like, wow, that's actually good. It's not from me, though. This is a greater purpose why I'm sharing this. And I've shared that for years. But now we can land there.
You can dig.
Which is really beautiful because I've told patients this for years, but it's kind of been, well, let's just cast our net out. Like, you need to know nutrition's important. You need to know exercise is important. Surely you do. And then you kind of get back to maybe the pressures or the metrics or the requirements of things that you're needing to do in that setting that may or may not be exceptionally helpful for that individual. Where now we're able to say, all right, let's land on these 5.
Yeah.
Maybe even let's spend a whole few hours talking about just one of them.
Yeah, because it's clearly something that you're dealing with.
Yes, and you can get into depth like I would have never even
dreamed. It's an accelerator.
It's
that
amazing.
Relationship depth.
It's really amazing because I truly believe those are 5 foundations and worthy of my attention, a member's attention. And like you kind of referenced, all questions are on the table. Everything's important. And everybody's unique. We may have a day where we see several members, but everyone is special. They have a different story. Different stressors, different joys, different families, different backgrounds. And to be able to consider that in our decision-making for what's best for their health is so beautiful, as opposed to feeling like you maybe have to pressure the masses, so to speak, into a one-size-fits-all program.
Perfectly said.